It's just amazing. Thank you so much for being here. Thank you so much for sharing so much of your story and your life with us. We have time for just a few questions, and I have a list, and I did get a few from the audience. I wonder if you could talk a little bit, Gloria. You talked about the moment in your childhood when you decided you wanted to be a doctor. You talked about Duke. Can you tell us a little bit about how you went from dedicating your life to medicine to really dedicating your life to these issues of social justice?
Thank you. And thank you, guys. I'm going to tell you, for me and my career has been eye-opening to me because I was very naive. I actually thought that once I graduated from medical school and stayed in D.C., I could help these children in the district who were very, very poor, just blocks from the Capitol. Blocks. Children living in homeless shelter hotels that were just horrible, right? Up and down New York Avenue, senators walking by and seeing these children and not doing anything. And I learned that there were some folks who weren't comfortable with the conversation on poverty. You know, they were comfortable with the conversation on charity, but not the conversation on poverty and justice, including sometimes the institutions, right? When I was at Children's National, I had gotten Oprah's award. We did wonderful things. But after Oprah's award, I was given a gag order, requested not to speak out without asking permission, because we had gotten so much attention about this issue on poverty. Now I understand why, that there are multiple things that institutions have to tackle. But my response to the gag order was that the community pediatrician will stop talking about poverty on the same day you ask the cardiologist to stop talking about heart disease, on the same day that pulmonary can't talk about asthma or infectious disease can't talk about HIV. That's the day we stop talking about the impact of poverty on these children's lives. So I helped to build the ARC, the clinics there. It's a $27 million facility that has theater, it has education programs, it has Boys and Girls Club, it has the Washington Ballet as partners, and I built a clinic there for Children's Hospital. And the day that we cut the ribbon, I resigned from Children's Hospital and started Core Health and Wellness Center, because I understand why they may be concerned about the conversation, but the conversation must happen.
Can you tell us a little bit more about your model at the wellness centers? How do you address these kids' lives and needs holistically?
Well, our wellness centers, you know, we focus on primary care, but we also have alternative medicine. We have a gym right in there. We have nutrition. We have yoga. We have, you know, all that kind of stuff. But the most important thing, honestly, is the time we spend. I don't limit my providers to 10 minutes or 5 minutes, right? Medicine is a volume-driven business, right? It's you got to see them fast in order to keep the lights on. Right, so we find other ways to keep the lights on, right, so that we can spend time with our patients. And we start our conversations talking about wellness, right? Not what's wrong with you, not even what your chief complaint is, but what do you want to accomplish in your life and how can I help, right? What's your goal? What's your goal for your children, right? And what's stopping them from achieving that goal that we might be able to help with? And then we do stuff like check your blood pressure and all that kind of good stuff. Let me tell y'all something that I'm gonna say, and it might sound blasphemous to you, but please stop screening everybody, okay? People are screened at grocery stores, they screened in parking lots, every church service got a screening. We're all screened, okay, we're screened, right? But if you don't do anything with the screen, right? If you don't provide quality care after the screen, for real, that's long-lasting and stuff, then all you did was make somebody depressed. I'm gonna just say that.
So I'm going to read this question. This question came from the audience, and I think it gets to the first point that you were just making about challenges of speaking out when you're in an organization. We all know that there are organizational leaders who actively block efforts to do our best work in communities. And the questioner writes, how do we push those folks off the bus?
Ooh, I want to know who that is. You can come. You can come work for Core Health. That's how you push them off the bus. But no, my thing is don't push them off the bus, right? Work around them. Work around them. We built a $27 million facility, right? A community built that facility. The founder was a developer named Chris Smith, who came to a bunch of us who he knew were doing good work in the community. And he said, people want a rec center because the kids are getting shot at 3 o'clock, because at the time in the district, the rec center opened at noon and closed at 3. So they had to skip school to play basketball. Like, really? Like that. So it was supposed to be a $1 million project, 5,000 square feet. He starts talking to all of us, and he comes to me, and he said, would you, your mobile van sometimes breaks down and stuff. Would you have a room in the rec center, where you could just see? I said, yeah. I said, but if you give me one room, could you give me 10? Right? And then he asked the mothers and the grandmothers, and they said, could we have dance class here? And before you know it, the Washington Ballet was at the table. Septine Weber. That was my first time meeting him, and he's fabulous, right? And before you knew it, the Boys and Girls Club was there, and they were building a huge gym, right? And we were meeting at the White House conference room. We're from the street. I'm a street doctor. We're at the White House conference room. It took 10 years to get the utility rights and all these other rights, the district's rights. And during that 10 years, some of our institutions, like mine, got a little wishy-washy, even though the money was raised, right? But what did we do? We ignored them. And we kept meeting. And we kept the construction guys working. And I remember, we're all out there with hard hats. Nobody knew from our institutions. We're out there with hard hats going, build that wall a little higher. Is that soundproof? And when we ran out of money, we went to the foundations and we said, can we have just a little more? Just a little more. Let me tell you why. Okay? We need the ballet. We need this. And before you knew it, in the poorest part of Washington, D.C., came a $27 million facility called the Arc, THEARC. Look it up, the Arc of D.C., right? And once the Arc opened, a side of the city that had no grocery store, the largest grocery chain, Giant Foods, came to the developer and said, we're thinking about opening a new Giant in Washington, D.C. It will be the largest Giant in this region. Why should we open it here? Do these folks buy groceries? And what they really meant, they were well-meaning. What they really meant is, can it sustain itself there? Then they saw what was built, 27 million. You got kids in ballerina outfits. You got prima ballerinas teaching little kids in the hood. Nobody's getting shot. We're kumbaya, and we got graduations going in the all-girls school that's in the building. And Giant made the investment, opened the place, hired like 168 workers from the community at a living wage. And it is now the highest grossing Giant in their chain. You can do it.
All right, I think we are out of time for question. That's what this blinking light is telling me. I think you'll agree with me. It's pretty clear to see why you're in the company of Mother Teresa and Jimmy Carter. Please join me in thanking Dr. Gloria Wilder.